So in the postpartum period, it's pretty likely that you'll have some sort of diastasis, which is a normal separation of the six-pack abs or the abdominal muscles, sometimes known as abdominal separation. And so if you want to assess for how much of a diastasis you have or how much abdominal separation you have, we're going to be looking for two things. First, we're going to be looking for the width, so how much space is there between the two six-pack abs. And the second thing we're going to look for is how deep can you put your fingers in. So what is the depth of that diastasis? So when assessing for a diastasis, you're first going to put your fingers into your abdomen. And if you can't quite feel the two edges of the muscle belly, you can do a little bit of a crunch to help activate in the abs. And then you could put your fingers in. We're going to look right around the belly button, below the belly button, and then above. And you may find that the width of the tissues there may be a little bit different. Usually the belly button is going to have the most width. Below and above may have a little bit less. For some of you may find you have more width above or below. And so this is just information for you to learn about your body. So you're going to feel where the two muscle bellies are. And then from there, you're going to feel how deep can you press into that diastasis. The next thing that we want to look for is what is the response of this tissue under activation or exertion. So when you increase pressure within your abdominal cavity or you increase the density of this tissue, is there any sort of change of width and depth that happens? If so, this would be a functional diastasis. So you come up into your little crunch so that you can more clearly feel the edges of the muscle belly. And from there, you're going to exhale to lift your pelvic floor up and in. Almost like try to pull these two hip bones together. And you should feel that the muscle bellies move a little bit closer together and your fingers should push out a little bit more. And so you'll figure out where the two edges are, crunch up, and then exhale strongly. And you should feel your fingers push out a little bit. And you might only be able to put maybe 2 or 1 fingers in between the diastasis. And so when assessing for your diastasis, it's important to note that there will always be some sort of separation between the abdominal muscles because they're not one solid sheet of muscle. It's 2 separate muscle bellies. So there will always be some sort of separation between the two of them. So the goal is to not have no separation at all. And the goal is not necessarily either to have only 1 or 2 fingers either. What we're looking for is tissue that responds to the demand. And so we want the tissue to respond by coming closer and also getting denser and pushing your fingers out. If anything, the density of the tissue is probably more important than how wide the tissues are. And so if you want more support in understanding your diastasis and also helping to heal it in the postpartum period, we can support you with our online postpartum fitness programs. Our online postpartum fitness programs are going to incorporate a lot of exercises that help to target both the obliques working together in addition to the transverse abdominis, so those corset abs. And so the different directions of the abs working together can help bring the muscle bellies closer together and also to increase the density of that tissue, which is probably stronger. The denser our tissues are and the denser our muscles are, the less easily they can be manipulated by pressure. And so this means that you're going to be able to meet greater amount of demand and you're going to have a greater functional capacity. So diastasis is a normal adaptation to pregnancy, and it can be normal to have somewhat of a diastasis into the postpartum period. You can assess for your own diastasis by coming into a supine position, placing your hand in the center of your abdomen, and feeling for the 2 edges of the muscle belly. Again, if you're having a hard time figuring out where the muscle bellies are, just a little bit of a crunch can harden them, and it's a lot easier to feel kind of where the 2 edges are. You can assess at the belly button, below, and then above. And not only are we looking for the width or how wide that tissue is, we're also looking at the depth. So how deep can you press your fingers in? The next step of the assessment is to learn what the activation is. So can you change the density of that tissue? Do your fingers push out? And then do the muscle bellies come closer together? That would be a sign of a functional diastasis or a diastasis that can respond to the demand, which is the goal and what we're looking for in the postpartum period. If you want more support in the postpartum period, join our online postpartum fitness programs. Our postpartum fitness programs are offered in 2 formats. We have our app-based program and the Team Builder app, which is going to be a list of exercises with demo videos. And then we have our on-demand videos, which is a full-length video that you follow at the same time. You can check out all of our online fitness programs at mamastefit.com/fitness-programs. And you can use code YouTube10 to get 10% off any of our online programs. So thank you for watching this video. If you enjoy this video, be sure to subscribe to our channel so that you get notified anytime we release new videos. Like and comment below if there's any videos that you want us to do to help support you in the postpartum period.